Hi, this video is to inform you of the new practice guideline for a PICC dressing change. The main point being the use of sterile gloves to apply the Stat lock. As you can see, this dressing is no longer sticking to the skin. The barrier to infection has been breached and needs to be changed. You want to take note of the external measure and compare it to the Cardex, and there is 2 centimeters of exposed catheter. If this was attached to IV tubing, I suggest anchoring it with a piece of tape so the weight of the tubing doesn't dislodge your PICC. Wash your hands, apply non-sterile gloves. I like to mask, but it is optional. You can also open the clasps of the Stat lock through the TSM dressing. I like to do that because you do not want to touch any part of the PICC with your non-sterile gloves, including the hub. Begin to pull back the dressing over the Stat lock, just enough to expose the Stat lock. You can leave the exit site covered, and I am stuck to the dressing. Patient position is very important. You want to make sure you've got a good visual and room to work away from the body. If there's a chance that the patient might move during the procedure, please get a second person to help hold the arm. Now you can lift the PICC out of the Stat lock. Take your alcohol swab and begin removing the Stat lock by wiping over the wing of the gauze and working at the edge. You may need more than one alcohol swab for this. Now you can continue to remove the rest of your dressing, being very careful at this point. Sometimes the dressing sticks to the PICC. You don't want to inadvertently pull it out. Just note, if your PICC does come out, please do not reinsert, as it is considered dirty. You need to let go of your PICC at that point. That's why a second person can sometimes be of benefit. Take your chlorhexidine swab using a basket weave and friction for 15 seconds. Clean around the site. Reverse your swab and go in the opposite direction for another 15 seconds. You want that to completely dry for 2 minutes so that the antimicrobial action can work, as well as you don't want to cover moist skin with the dressing. That will certainly increase the risk for skin irritation. You don't want to fan or blow on the site. Also, if there was debris at the site, then you're going to have to repeat the process of cleaning again until it is clean. Remove your gloves. Wash your hands and apply your sterile gloves. It's also good to have a good working area and have all your supplies opened and ready to go. Take a sterile 4x4, use it to lift up the extension legs, and place your PICC into the Stat lock. Also taking notice of the external measure, that it matches what it was at the beginning. You can also use your gloves to palpate around the site for tenderness or induration, and apply your new TSM dressing. You would document the external measure in your charting as well as your assessment of the site. Hope that helps. Thank you.